Dr. Warrior is Ponca and is a licensed psychologist. She attended Little Priest Community College and went on to the University of Nebraska-Lincoln and received her bachelor's in psychology and master's and PhD in counseling psychology. Dr. Warrior is very connected to her culture and her tribal community, and she strives to create a system of care that promotes holistic healing.
So as we talk about academics and health research, you will see that in these two columns, I have some of the same words, specifically the empowerment and the opportunity, because both academics and research are opportunities that can empower you, your family, and your community. They can do that by, one, the knowledge that you learn, how you're able to change systems, and we'll talk a little bit more about that later, and then just what you're able to give back to the community. So opportunity and empowerment are extremely important, rewards, I would say, actually, that come from academics and research. When I mention on academics, the degree of personality, the reason I mention that is because as you navigate through your academic career, it's really important to study what speaks to you, what you feel comfortable with. A lot of people will go into careers or go into various disciplines in school, and they're thinking about the money or what they can do with that career, but then thinking about, okay, how does this fit with me? So for me as a psychologist, I don't typically feel like I'm at work. Meeting with people and providing treatment plans, it's something that I often leave work feeling rejuvenated. I can do 8 sessions back to back, write some reports, go home and feel very happy with how my day went, who I interacted with, and how things happened. So, but it fits with my personality. And so that's a really important thing to keep in mind. The 3 Ps are something that I like to talk about as well. So patience, passion, and perseverance. And patience, just in the fact that you're not going to get a degree very fast. You could be on a track to get a degree every 2 years, basically. So your associates, your bachelor's, master's, and just continue to move forward that way. But it does take time. So just remembering to be patient about that. Passion, that goes back to that degree of personality. So going with something that you're passionate about, that excites you, that speaks to you. And then the perseverance, that goes more back to that illusion of success with the iceberg. So that perseverance, you have to have that as you're moving through school. With research, you have a lot of opportunities to participate in research. And I would highly, highly recommend that at any level of education, you get involved with research, whether it's conducting research or being a participant in research. It's just an amazing experience that you can learn so much, and it really does lead to benefits for communities and for individuals. Some of the implications of research that you will see will be policy. So we have a lot of lawmakers, senators, mayors even, that read research. They will read medical journals. They will read sociological journals, psychological journals, all of those to inform themselves on what laws we need to change. What do we need to be addressing? Now, it doesn't always happen quickly, but a lot of research or a lot of lawmakers, excuse me, do look at research to inform their policy. There's education that will be impacted for you, for your community, and then even just the way we learn, because with research, there's a level of critical thinking that's going to happen. So you question things in a way that you haven't ever questioned them before, but it's a level of critical thinking that will happen. And that continues to grow as you go through graduate school. Research can also change treatment approaches and have an impact on ethical considerations. And I'm going to talk a little bit more about the treatment approaches through research as I talk about my work as a psychologist. Okay, so my work as a psychologist, with my training, we are considered scientist practitioners. So basically what that means is science informs our practice. We're very heavily based on research, but then our practice also informs our research. So if there's a phenomenon that's happening during our work, we want to understand more about it. And in order to do that, we have to do research. And so that could be at a local level, at a national level, but it's still something that's going to inform our work, so we can be the best that we can in terms of making change in lives happen. In doing this, there's so much diversity in how you do research. So we have quantitative methods, qualitative, and mixed methods. And I'm going through this very quickly, okay? So quantitative is going to be when we're looking more at measurements. We're doing different types of scales, but it's really focused on numbers and how we can measure those things. Qualitative is something that we do when we're looking for rich data. So it's going to be more interviews. There's not really any scales in there, but we're hearing from people, we're talking with them. And then mixed methods is just what it says, we're mixing them. So we're bringing in quantitative and qualitative. With this research, though, you can do what is called cross-sectional, which is just going to be at that one time point, or you can do longitudinal. So I may take some information now, take some information in a few months, take some information a year later, and then I see what those differences are. So there's many different ways to be looking at the research that you're doing and how you're doing it. But the clinical implications are so important because you can develop gold standards, which are just, this is the best type of treatment that's based on evidence and the research that's been done. But then you can also see population differences. And this is something that's really important to us as Native people, because there are many times that there are models of therapy or models of treatment that are almost pushed upon us, and they don't necessarily fit, but because that's what's out there, that's what they're using. So being able to use research to make those changes is so very important. Thank you all for allowing me to do this presentation. Thank you for asking me. And I hope that there was information that you'll be able to take, even if it's not specific to today, maybe later down the road, it's something that can be helpful.